Around 300,000 dogs and cats are bitten by poisonous snakes each year in the United States. In our practice in Central Texas, we see 1 or 2 bites per week during the peak times, which are the spring and fall. In this area, the western diamondback rattlesnake is the most common snake that we see bite our pets. It's very obvious if your pet has been bitten by a rattlesnake because usually their face or one of their front paws will be extremely swollen, much more than you'd see with a wasp or a bee sting. Untreated, the pet could die, depending on the size of the pet, the size of the snake, the amount of venom that is actually injected. If your pet is bitten by a rattlesnake, it's very important that you bring them right to a hospital and have them examined and have the diagnosis made so that treatment can be initiated right away with fluids. We give them IV fluids, different medications to decrease the body's reaction to the venom. We give them antibiotics, and in a lot of cases we'll give them anti-venom to help counteract the venom. The treatment can be anywhere from 1 night in the hospital to a week and can be very expensive. There is a rattlesnake vaccine available for dogs, which can help greatly reduce the reaction to the snake bite, the tissue death, amount of swelling, and anticoagulation. Vaccine is relatively inexpensive. It's given usually at the time of peak rattlesnake time, either spring or fall. Typically in March or April is when we'll begin it, and given once a year or twice a year depending on the area you live in and how common the rattlesnakes are in the area. The rattlesnake vaccine can have some side effects such as swelling at the injection site. We only recommend this vaccine for animals that are in an area where you've seen snakes. If you live in the country or in areas where there's a lot of rattlesnakes, we definitely recommend it. If you live in the city and no one's seeing snakes in your neighborhood, then it's not a vaccine we would recommend. In our experience, a vaccinated dog will spend about 1 night in the hospital, whereas an unvaccinated dog can spend up to a week in the hospital. Besides the vaccine, some of the things you can do to keep your dogs from getting bitten by rattlesnakes are keep them on a leash, especially in tall grass. I'd keep your yard mowed short, keep any wood piles taken out of your yard, anywhere they can hide. The less likely they have a place to hide, the less likely it is that you're going to find a rattlesnake in your yard and your dog's going to find it and get bitten. There's rattlesnake aversion training which you can do for your dog, which can help as far as keeping your dog away from rattlesnakes when they find them in the wild. We care about your pets and we want them to be happy and healthy, and if you live in an area where you see rattlesnakes, we recommend that you vaccinate for it. This is a simple, usually a technician appointment if you've seen the doctor recently, and you can be in and out of the hospital in 15 minutes.